a short introduction before you take up. Farm Okechi, she is a public health consultant from Nigeria. Also, WHO, World Health Organization certified Infodemic Manager, Association of Clinical Research Professionals, the Pharmaceutical Society of Nigeria, and Boardroom Africa, among others. She is the Chief Executive Officer / Managing Director / Pharmacist of High Stripes Nigeria, a manufacturing and retail pharmaceutical company. She has over 20 years of experience in leadership, operations, planning, developing and implementing procedures, product manufacturing, and management. Her practice at High Stripes Pharmacy includes patient counseling, primary prevention, clinical research, pharmacy management, planning, development, implementation and human resource, and supply chain management. She is the founder of Health and Living, a health outreach offering health information, free consultations, eye checks, free and subsidized medicines, and laboratory services to communities. She is about to present on the topic Infodemic Management in Health Emergencies and Integrative Approach. Over to you.
Thank you. Good day, everyone. The introduction has been done, and I'll be discussing infodemic management in health emergencies and integrated approach. Now, we're going to talk about the impact of infodemics. Why do we need social listening as well, and integrated analysis? The objectives aim to provide an understanding of infodemics and infodemic management. This will give us insights into the role of infodemic management in health emergencies, the harms that infodemics can cause, and why it is necessary to address these issues. Additionally, to understand how evidence generation is essential in infodemic management and how it underpins an integrated approach. To understand how to respond to infodemics using an integrated approach, to enable country level, health facility level, and community level actions to manage infodemics. In February 2020, at the inception of the COVID-19 pandemic, the Director General of WHO made a profound statement. We are not just fighting an epidemic, we are fighting an infodemic. Infodemic became a new phenomenon. It does not just affect a part of the society, but all. From that point till now, many consultative meetings, programs, and trainings have been organized to hone this novel area of public health. Now we get to the definitions. What do we understand by a health emergency? Globally, we are besieged with natural and artificial disasters that affect the population. A health emergency arises when a situation impacting the health and well-being of a large section of people or a significant percentage of the population occurs. It requires substantial multi-sectoral assistance. And for a WHO response, there must be clear public health consequences. So what is an integrated approach? An integrated approach is an approach combining different techniques to promote healthy outcomes. Different techniques leading to the desired outcomes are harnessed for infodemic management. What is an infodemic? An infodemic is an overflow of information of varying quality that surges across digital and physical environments during an acute public health event. It underpins risk-taking behaviors and perplexities that can harm people and adversely affect health. The public health response is neglected and distrust in health authorities grows. Information is spreading fast because of the growing digitization where social media and the internet have grown unprecedentedly. Infodemics intensify when people are unsure of what they need during an emergency or an outbreak. And data and evidence-driven approaches in health instill trust in the recommendations following them. Also, when approaches are centered around people, it creates a better environment for collective support and cohesion. Then infodemic management is a data and evidence-driven and human-centered practice. We'll discuss more of that later. We have a few more definitions to go. Now we have the information ecosystem, where you have an exchange of information and communication in a digitized society, which involves the use of information and communication technologies. You have rumors, which are accurate or inaccurate information circulated within a network. Misinformation is inaccurate information. People work with whatever information they can lay hands on when they need it. They may not wait for health authorities to release any guidelines or advisories. Disinformation in itself is misinformation that is specifically designed to achieve an agenda. Information voids happen when people seek information but lack credible sources of information. The information people need keeps changing in emergencies and opening up gaps in knowledge. When health authorities understand this evolving landscape, communication strategies can be tailored to meet the needs of the public. Infodemic affects everyone. The problems posed by infodemics and the impact created in global health depicts the need for collective action to manage emergencies. You find out that multisectoral and multidisciplinary approaches will help achieve this. People process information emotionally. We have to take note of that. Infodemics affects everyone, no matter who you are, and includes questions, concerns, narratives, information voids, information overload, as well as outdated information, misinformation, disinformation during an emergency or disease outbreak. You find out that the population that are more susceptible are the isolated and the vulnerable. An example is about people who live in places regularly experiencing overflooding, and they find it difficult to access vital information. The infodemic can cause harm during these outbreaks. These will affect the design of interventions needed to mitigate the damage caused by infodemics. Now, in emergencies, the supply and demand for information increases. The terms, questions, concerns, information voids, outdated information, they are not new now at this stage. It's clear that the infodemic is more than misinformation. Looking at this slide, you'll find boxes inside the ellipse on the left containing questions, concerns, and information voids, and some in a circle on the right with misinformation and disinformation. Often during emergencies, no definitive answers are provided as crisis develops. People stick to the first information they get, and health authorities should respond at this point. The health systems have more influence on the questions, concerns, and information voids, and less impact on misinformation and disinformation. Health authorities can provide prompt, precise, and functional information to the public to tackle those questions, concerns. Misinformation can be very sticky and spreads in real time, diluting conversations and distorting understanding. The more the misinformation, the more we read it and believe it is true. And Daniel Kahneman said, frequent repetition is a reliable way to make people believe falsehoods, because familiarity is not easily distinguished from the truth. This information is falsehood, intentionally generated, tactfully designed to make you read it and share it immediately. For this, the health authorities must partner with fact-checking organizations to keep up with misinformation and disinformation. Now, looking at the impact of the infodemic, looking at the COVID-19 pandemic, for instance, then it raised awareness on the impact of infodemics. And that's why we have a lot of spotlight on infodemics right now. Infodemics have led to mistrust in governments, and people misunderstand the health information and advisories they receive. There's loss of social cohesion, and the community members cannot converge towards a common goal to end an emergency. So, infodemics give rise to multiple narratives that drive harmful effects. During the COVID-19 period, some people drank methylated spirit. So in my area where I come from, just to kill a COVID-19 virus, but of course, those were misinformation that were traveling across the digital divide. Now, it's difficult to directly measure the impact of infodemics on individuals and health systems. Once the health system issues an advisory, many reactions trail it in the society. The media will have their own pronouncements. Individuals and communities will have their own pronouncement because it spreads both offline and online. The harmful effects of infodemics in emergencies can be physical, social, economic, political, psychological. Infodemics in any disease outbreak fuel victimization, stigma, and mental health challenges. And this needs to be watched whenever we have issues of infodemics. Now, to address questions, concerns, and information voids in the community, circulating narratives and conversations need to be analyzed. Information should be shared through the media the population can access easily. And there should be use of notable people as trusted messengers who they trust and resonate with. Like musicians who they listen to their music, they can be used. Now, what is infodemic management? Infodemic management is defined as the application of evidence-based interventions by analyzing concerns, questions and narratives, information voids, misinformation, to effectively address health information inequalities in at-risk populations and communities, to drive health-seeking behaviors. So we see that infodemic management encourages good health practices by doing a SWOT analysis, listening to questions and concerns from the community, building resilience to misinformation, boosting understanding of risk and health expert guidance, engage and empowering communities to take positive action. And to effectively do this, it employs 5 steps to prevent, detect, and respond to infodemics. And these steps include preparing, monitoring, detecting, intervening, and strengthening the systems. Preparing through social listening and integrated analysis, and monitoring through health information, detecting through evaluation, intervening through promotion of community engagement, and strengthening preparedness and planning. Why do we need social listening? Social listening in infodemics is crucial for infodemic management. Information bombards people offline and online, so there's a need to listen to what people are saying. People are not in the habit of waiting for science to generate all evidence before engaging in misinformation. This is because it takes time for scientific evidence to emerge, so listening is necessary. By this, the narratives are uncovered for adequate intervention. Social listening is used in infodemic management to identify narratives in the form of questions, concerns, information voids, misinformation, disinformation that are circulating online and offline. These data are subsequently triangulated with other data sources for proactive intervention. Please note, it's for proactive and not for reactive action. These data sources These data sources include community dipstick for exploratory search to measure the scope of the problem. You also have the survey of online users, community listening, hotline reporting, amongst others. And we note with the inception of artificial intelligence, the WHO launched a social listening platform known as EARS. You can see it on this slide. The early artificial intelligence supported response with social listening. And this project is powered by CityBits, which is a text analysis platform specialized in social understanding. It shows real-time information on how people are talking about issues. This particular, the data we have here is on the COVID-19, was harnessed during the COVID-19 pandemic. And you find that data is collected daily from online conversations in publicly available sources, those sources that are available to the public, including Twitter, Facebook, public pages, news comments, blogs, and this covered 30 pilot countries in 9 different languages. It gives regular snapshots of ongoing environmental conversations, questions, and complaints. Different social listening platforms, the EARS, the Google Trends, Newswhip Analytics, the Brand24, the UNICEF Talk Walker, dashboards, and others. They all contribute to social listening and social understanding in the environment. On these platforms, you can even discover conversations around issues like polio, HIV, diphtheria, cholera, others. Many things that people are talking about. Data from social listening is integrated with other data from different sources. An integrated analysis is fundamental. It is the triangulation of multiple data sources and findings of recurring issues of concern or themes to provide actionable understanding for tailored intervention. Integrated analysis is necessary because it engages more data sources besides social listening. You have field epidemiology reports, peer-reviewed articles, and marketing and communication campaign performance data, all help for integrated analysis. Now, integrated analysis can be conducted using intelligence reports pulled from the database that we have. We have the data from different data sources. At the end of collation of the data, infodemic insights are produced for recommendation. The data sources give intelligence reports, which is integrated for recommendation. This now brings us to pre-bunking and debunking. If health misinformation is not already circulating, pre-bunking is done, where messages are sent to mitigate the effect of false messages, misinformation. If misinformation is already circulating, debunking is done, especially when it has potential public health consequences, whereby messages are put out to the social space so that it can mitigate the effect of misinformation. Now, we have this as an example of a threat classification matrix of US CDC State of Vaccine Confidence Insights report. This classifies how infodemics are affecting people's response to vaccines. This was done during the COVID-19 pandemic. Does it pose a high, moderate, or low risk? Do you have any positive sentiments from the population? It also shows how the theme is changing over time. So now, whether the theme is increasing, stable, or decreasing will determine whether pre-bunking or debunking is necessary. So the risk matrix helps us to know exactly what time to debunk and at what time to pre-bunk and not to also bother putting out any message into the public space. Now, to support preparedness and prevention of health emergencies, an infodemic landscape analysis is needed. which is a rapid SWOT analysis. This will help to outline what is to be achieved from the program. Staffs and data sources should be available. Be ready to meet with the stakeholders in the community and establish partnerships. If the district already has a structure for responding to emergencies, this could be leveraged and adapted to fit into current use. You have to detect gaps or information voids for effective intervention. A human-centered approach and design are needed to get meaningful results. And a human-centered design is about people being at the center and engaging stakeholders to design the process of supporting preparedness and prevention of health emergencies. It's a co-design and collaborative process because people have their own stories, their norms, their values, so the solutions must match their habits and inclinations. Test the solutions with them and see if it works. If it's not efficient, adjust and test again. If the people do not understand or align with the objectives of the design, it slows the progress of the infodemic management. Now, we will discuss national level actions to manage infodemics. It is necessary to conduct social listening and integrated analysis with other data sources to discover information voids and circulating narratives. You can employ user journeys to explain how people look and discover health information. From this, you will find weaknesses in the information environment. Audit the authoritative health information channels for the acceptability of their content. Prepare responses for frequently asked questions and misinformation that are circulating. Repurpose it for phone scripts, web content, print, audio, or video formats, and spread widely through the different levels of the health system. It is necessary to build a content strategy anticipating infodemic risks. Different communities may have diverse ways of seeking health information, primarily because they have unique access and digital literacy challenges. It then becomes necessary to tailor content and approaches to the most vulnerable populations and create a segmented infodemic strategy for each group. Define indicators that assess individual factors like knowledge, awareness, perception, and trust in health information. This will help to link online efforts to offline behaviors. Connect to media, fact-checking organizations, medical associations, community leaders, trusted messengers, and social media networks used by the target population networks to implement infodemic strategies. Share insights with them and develop a feedback loop to collect their data. Now, to manage infodemics at the health facility level, you can use the waiting space area to share educational materials like flyers, posters, pamphlets, videos, health education, health educators, mobilizers, QR codes, and visual job aids for health workers is very important so that they can do their work very well. This will make high quality information content widely available. Chatbots are helpful for quick content sharing on websites, social media, and messaging platforms, and encourage patient conversation, including the ones that are not synchronous. WhatsApp, Facebook promotion, radios, and live stream call-ins are also helpful. Addressing patients' questions can be challenging, so health workers need training to manage their questions, concerns, and misinformation effectively. Job aids on conversations and frequently asked questions for most questions and concerns and materials rebutting common misinformation need to be developed so that the work will be effectively done. To manage infodemics at the community level, shared health information by trusted messengers and institutions need appropriate coordination. Trusted messengers, you can use the musicians, the comedians. Provide social listening and infodemic insight to address emerging narratives and reshare social content media. Social media content. Use WhatsApp or email listing to share fresh content and key messages. You can build a bureau of health professionals who can speak to community groups online and offline on different health topics. The nurses, doctors, pharmacists, you have psychologists. Equip them with media training, key messages, and essential presentation content. Then you offer digital native health workers the support they need while using social media, because they will need help in order to address questions, concerns, and misinformation. Now, different strategies help manage misinformation and disinformation. So apart from the WHO ES platform mentioned earlier in the presentation, the Vaccine Demand Observatory is another example of social listening platform. It's a collaboration between UNICEF and the Yale Institute of Global Health. It equips countries with customized social listening programs that boost vaccine demand and address misinformation. So you now have the Africa Infodemic Response Alliance, the IRA, which is Africa's network to share weekly infodemic insights on proven health facts to counter misinformation. And they have a brand called Viral Fact. It's a fact-checking arm that cross-checks narratives to prove the authenticity of falsehood. So Viral Facts in itself is a social content response to Africa's infodemic. It is the public face of the Africa Infodemic Response Alliance. It debunks misinformation in the system, false claims, false memes, and videos. Now you have the International Fact-Checking Network also that comprises the fact-checking organizations globally. So it's necessary to note that by the time debunking starts, the misinformation has started and reached a broad audience. So the required visibility of the debunking is low. Since this is a big challenge, pre-bunking is recommended, putting the correct information ahead of the misinformation. It addresses information gaps before the misinformation starts to thread and requires ongoing social listening and frequent content development, using fact-based and science-backed information verified by the WHO experts. So now in conclusion, in emergencies, people process information. They tend to believe the first information they get, then look for additional sources of information, and they have trouble processing complex information. In this function, infodemic management is intimately linked to a strong communications and RCCE response. There's always an inherent tension between being first and being right in communication. But infodemic management insights can help shape messages and their delivery that address people's concerns and information voids quickly. To foster an information environment during emergencies, health authorities should use an integrated approach to respond swiftly to meet the speed with which misinformation is spreading. These are the references, and we have suggested readings. Thank you.
Thank you. Thank you for your wonderful presentation.